Bismillahirrahmanirrahim. Hello everybody. So a 37-year-old woman is brought to the emergency department by her boyfriend for severe abdominal pain that started several hours ago. The patient started diffusely in the peri-umbilical area but is now mostly localized to lower abdomen. The patient has persistent nausea but no vomiting. Her last menstrual period was 25 days ago, but she has irregular periods. She is sexually active with her boyfriend. Her temperature is 36, blood pressure is 130 by 80, and pulse is 110 per minute, and respiration are 25 per minute. The abdomen, especially in the lower quadrant, is tender on palpation with mild guarding. There is no shifting dullness. Bowel sound are diminished. Laboratory results are as follows: hemoglobin 13.1 gram per deciliter, hematocrit 43%, white blood cell count 10,000. Which of the following is the most appropriate next step in management of this patient? Abdominal CT scan, diagnosis, peritoneal lavage, pelvic ultrasound, pregnancy test, upright chest X-ray. So first of all, this patient having 37 year and she was brought to the emergency department by her boyfriend for severe abdominal pain. The pain started in peri-umbilical area and is mostly localized to lower abdomen. Patient experiencing nausea. Her last menstrual period was 25 days ago and she is sexually active with her boyfriend. On examination, the abdomen is tender to palpation with mild guarding. So based on these symptoms, first of all, we will go toward the pregnancy test. So here the choice D is the correct one. Why the pregnancy test? Because as we know that these all sign and symptom go toward the diagnosis of pregnancy, because during pregnancy the patient and the first day experience the nausea, vomiting, headache, constipation. So first of all, we will go toward the non-invasive procedure, the procedure test, that is the pregnancy test, because as we know that radiation is harmful to fetus and it will cause developmental delay. So first of all, we will go toward the choice D, pregnancy test. After that, if the pregnancy is negative, then we will go toward the CT scan or more investigation. So the differential diagnosis of this question is first of all after the pregnancy. Then the differential diagnosis is first of all GI symptom, that is peptic ulcer, appendicitis, intestinal obstruction, perforation, the genitourinary problem, for example kidney stone, ectopic pregnancy, ovarian torsion, pelvic inflammatory disease, and vascular ischemia, that is bowel ischemia, and musculoskeletal problem. So if the pregnancy test is negative, then we will go toward the abdominal CT or the other choices given below. So now I will explain the incorrect one, choice A. Why the choice A is incorrect? Incorrect one, abdominal CT scan. Because if the pregnancy test is negative, then CT scan of abdomen can be performed to rule out appendicitis or kidney stone. Choice B, diagnostic peritoneal lavage. So as we already know that the diagnostic peritoneal lavage is an invasive procedure and it can be performed in a patient having intra-abdominal bleeding. For example, patient is suffer from trauma. So this patient is not suffer from trauma. So this is not this is not the choice to perform in this patient. So choice C, pelvic ultrasound. So pelvic ultrasound can also be helpful for evaluating ovarian pathology. If the pregnancy test became negative, then pelvic ultrasound can be done to rule out the ovarian torsion or the something else. So the pelvic ultrasound can be done in that and their choice. Now come to the incorrect, the choice E, upright chest X-ray. So upright chest X-ray may also be considered to rule out intestinal obstruction or perforation, which is a free air under the diaphragm. So here the correct option is choice D, pregnancy test. First we will have to rule out the pregnancy. After that we will go toward the invasive procedure, that is the abdominal CT scan or pelvic ultrasound or chest upright, because that procedure is consists of radiation, and radiation is harmful to fetus, which can cause fetal growth delay. Thank you.